Right now, somewhere in your kitchen, there is something you use almost every single day, something you were told is fine, something doctors hand out advice about without a second thought, and it is quietly, steadily doing serious damage to one of the most vital organs in your body, your kidneys. I am not talking about alcohol. I am not talking about junk food. I am talking about something far more ordinary, something sitting on your counter, inside your cabinet, possibly right next to your stove at this very moment. I have spent years in clinical practice watching patients come in with declining kidney function, elevated creatinine, protein leaking into their urine, and the first thing I ask them is always the same question. What are you taking every day that you consider completely harmless? The answers shock people, because the answer is almost never cigarettes or alcohol. It is the things they never questioned, the things that seem innocent, the things nobody warned them about. After 60, your kidneys are not the same organs they were at 35. They have changed structurally, functionally, and in terms of how vulnerable they are to damage. And the substances that your body handled effortlessly decades ago can now quietly accumulate and erode function you will never get back. My name is Dr. Nura, and this channel exists because the conversations happening inside medical offices are not the conversations you need to be having. What I am about to share with you today is based on real nephrology research, real clinical data, and real patterns I see repeatedly in patients who are losing kidney function without. Any idea why? Stay with me until the end of this video. I will tell you exactly what these hidden kitchen poisons are, what they do inside your body, and most importantly what to do instead, because the damage is preventable, but only if you know what you are dealing with. Before I name the specific culprits, I need you to understand something important. Something that explains why this matters so much more now than it did 20 or 30 years ago. Your kidneys are extraordinary organs. Each one contains approximately 1 million microscopic filtration units called nephrons. Every single day, those nephrons filter roughly 200 liters of blood, that is about 50 gallons, removing waste, balancing electrolytes, regulating blood pressure, and producing hormones that tell your bones to stay strong. Here is the problem. You are born with a fixed number of nephrons. When one is damaged and dies, it does not regenerate. It does not grow back. It is simply gone. The remaining nephrons compensate, they work harder, but compensation has limits. After the age of 30, you begin losing nephron function at a rate of roughly 1% per year. By the time you reach 60, you may already be operating with 70 to 75% of the kidney function you had as a young adult. And that number does not account for any additional damage from medication, diet, or lifestyle. This is why the same substance that your kidneys cleared effortlessly at 40 can accumulate and cause measurable harm at 65. The threshold has changed, the margin for error has shrunk, and the substances I am about to describe exploit that reduced margin directly. There is one more thing I need you to understand before we go further. Kidney damage is almost completely silent in its early stages. Your kidneys do not have pain receptors the way your muscles or joints do. You will not feel it happening. By the time most people notice symptoms, fatigue that does not lift, swelling in the ankles, foam in the urine, changes in how often you urinate, significant damage has already occurred. This is why what I am about to tell you matters so much. Prevention is the only real strategy. Treatment can slow decline, but it cannot restore what is already lost. I want to start here because this is the one that surprises people the most: ibuprofen, naproxen. The orange or white pills that are in virtually every medicine cabinet in the country. Pills that are sold without a prescription, marketed as mild, everyday pain relief, and taken by millions of people every single day. Here is what ibuprofen actually does to your kidneys. It belongs to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs work by blocking chemicals in the body called prostaglandins. Prostaglandins are part of the inflammatory response, which is why blocking them reduces pain, but prostaglandins also play a critical role inside your kidneys. Specifically, they help regulate blood flow to the nephrons. When you take ibuprofen, you reduce blood flow to the kidneys. In a young, healthy person with excellent circulation and full kidney reserve, this temporary reduction is manageable. The kidneys compensate and recover quickly. But after 60, your kidney circulation is already less robust. Your blood vessels are less elastic. Your cardiac output is lower. Your kidneys are already working with reduced blood supply. Add ibuprofen on top of that, and you create what nephrologists call acute kidney injury. Even 1 or 2 days of regular ibuprofen use in a senior can measurably elevate creatinine levels, a marker of kidney stress. You sit consistently over weeks or months and you accelerate the very decline I described earlier. The particularly dangerous pattern I see in patients over 60 is this. They have joint pain, back pain, or arthritis. They take ibuprofen or naproxen daily for weeks, sometimes months, because it works and because nothing on the label tells them to stop, and all the while, their kidney numbers are quietly worsening. If you are taking any NSAID regularly, and that includes ibuprofen, naproxen, aspirin in high doses, and many prescription anti-inflammatories, please speak with your doctor about alternatives. For most types of pain, acetaminophen is significantly safer for kidneys when used correctly. Physical therapy, topical treatments, and anti-inflammatory dietary strategies can also dramatically reduce the need for oral NSAIDs. When I say hidden kitchen poison, this is the one I am most specifically warning you about. Because when most people hear too much sodium, they think of the salt shaker on the table, and they think, I do not use that very much, I am being careful. But here is the reality. The salt shaker accounts for only about 11% of the sodium most people consume. The other 89% is already inside your food before you ever open the packaging. It is in your bread, your soup, your crackers, your salad dressing, your canned vegetables, your deli meat, your breakfast cereal. Your condiments, even foods that do not taste salty like certain desserts and beverages, can contain significant amounts of sodium. Now, why is sodium so damaging to kidneys specifically? When sodium levels in the bloodstream rise, your kidneys must work harder to filter and excrete the excess. This raises blood pressure inside the tiny vessels of the nephrons, vessels called glomeruli, and that elevated pressure, sustained over time, physically damages the filtration membrane. This is a well-documented, well-replicated finding in nephrology research. High sodium intake accelerates glomerular damage, increases protein loss through the urine, a condition called proteinuria, and directly speeds the progression of chronic kidney disease in people who already have some degree of impairment. After 60, virtually everyone has some degree of impairment. The World Health Organization recommends no more than 2,000 milligrams of sodium per day. The average adult in many countries consumes between 3,400 and 5,000 milligrams. That is nearly 2 to 3 times the recommended limit, and most of it comes from processed and packaged foods, not from consciously adding salt. What do you do? Read labels. A simple rule: any food with more than 400 milligrams of sodium per serving deserves scrutiny. Choose low-sodium versions where available. Cook from whole ingredients whenever possible. Use herbs, rosemary, thyme, garlic, lemon juice to create flavor without sodium. Your kidneys will respond to lower sodium intake. Within days, the pressure inside those glomeruli will drop, the damage slows. This one is particularly important because the advice to increase protein intake after 60 is everywhere, and it is not entirely wrong. Sarcopenia, the age-related loss of muscle mass, is real, and protein does play a role in slowing it. But the way many people have interpreted this advice has created a quiet kidney crisis. Here is the mechanism. When you consume protein, your body breaks it down into amino acids and uses them for repair, muscle building, and metabolic functions. The nitrogen waste products from this process, primarily urea, must be filtered and excreted by your kidneys. More protein means more nitrogen waste. More nitrogen waste means your kidneys must work harder and faster to clear it. This increased filtration demand is called glomerular hyperfiltration. In the short term, it sounds like your kidneys are simply working efficiently, but sustained hyperfiltration places mechanical stress on the nephron walls, accelerates protein leakage, and over time contributes to nephron burnout, the permanent loss of filtration units. For people under 40 with healthy kidneys, very high protein intake is generally manageable. For people over 60, especially those who have any degree of kidney impairment, diabetes, or hypertension, which describes the majority of that age group, high-dose protein supplementation can genuinely accelerate kidney decline. The issue is not protein in general. Protein from whole food sources, eggs, fish, legumes, poultry, is distributed throughout the day and accompanied by water, fiber, and other compounds that moderate its impact. The issue is protein powders and supplements that deliver 40, 50, or even 70 grams of concentrated protein in a single serving, consumed in addition to regular meals. If you are using protein supplements, have a conversation with your physician about what your kidneys can actually handle. For most seniors, 0.8 to 1.0 grams of protein per kilogram of body weight per day from whole food sources is appropriate. Significantly more than that, especially from concentrates, deserves careful monitoring. This is the section most medical professionals do not discuss in enough detail, and I believe that omission is causing real harm. The supplement industry is largely unregulated. Products sold as natural, traditional, or herbal carry none of the safety requirements or kidney toxicity testing that prescription medications must pass. And yet, some of the most potent kidney toxins known to medicine are naturally occurring plant compounds. Aristolochic acid, found in certain traditional herbal formulas still available in various markets, causes a specific pattern of kidney scarring so distinct it has its own medical name: aristolochic acid nephropathy. It is progressive, irreversible, and causes kidney failure. Chromium picolinate, widely sold as a blood sugar and weight loss supplement, has been linked to acute kidney injury in multiple case reports. Star fruit eaten fresh or as juice contains oxalic acid in concentrations that can cause acute oxalate nephropathy, particularly dangerous in anyone with pre-existing kidney impairment. Certain Ayurvedic preparations have been found to contain undisclosed heavy metals including lead and mercury, both of which are directly nephrotoxic. I am not telling you that all supplements are dangerous. I am telling you that the phrase "it is natural" has no relationship to whether something is safe for your kidneys. Before taking any supplement, herbal, traditional, or otherwise, check it against published nephrotoxin databases and discuss it with your physician. What you do not know absolutely can hurt you. I want to be direct here because this one is underestimated in almost every conversation about kidney health I have ever witnessed. Your kidneys cannot filter blood they do not receive. When you are dehydrated even mildly, chronically, blood volume drops, blood pressure drops, and blood flow to the kidneys drops. The nephrons receive less supply. Filtration slows, waste products that should be cleared begin to accumulate. Mild chronic dehydration also means that the urine your kidneys do produce is highly concentrated. Concentrated urine creates the perfect environment for kidney stones, crystallized deposits of calcium oxalate, uric acid, or other compounds that form in the collecting ducts and can cause excruciating pain and physical damage to kidney tissue. After 60, there is a well-documented decline in the thirst sensation. The physiological signal that tells you to drink becomes less reliable. You may genuinely not feel thirsty even when your body is significantly underhydrated. This is not a character flaw. It is a normal age-related change in the hypothalamus, the brain region, that regulates thirst, but it means you can no longer rely on thirst as your primary signal to drink. How much water do you need? A commonly cited clinical guideline is approximately 30 milliliters per kilogram of body weight per day. For a 70-kilogram person, that is about 2.1 liters, roughly 8 to 9 cups. This is a baseline, not a ceiling. Heat, exercise, certain medications, and illness all increase that requirement. A practical and reliable indicator: your urine color, pale yellow similar to lemonade, indicates adequate hydration. Dark yellow or amber means you need more water immediately. Clear can indicate overhydration, which is less common but also not ideal. Make checking urine color a habit. It is one of the simplest, most direct windows into your kidney health available without a blood test. Now I want to shift, because the purpose of this channel has never been to frighten you. It has been to inform you, and knowing what harms your kidneys is only half the picture. The other half, the part that gives you real power, is knowing what protects them. The first and most important protective measure I can offer you is consistent hydration, as I described. Water is literally the medium your kidneys work in. Prioritize it above everything else I am about to say. Berries, blueberries, strawberries, cranberries are among the most kidney-friendly foods available. They are low in potassium, low in phosphorus, rich in antioxidants called anthocyanins, and multiple studies have linked regular berry consumption to reduced markers of kidney inflammation. They are also one of the rare categories where the research is strong and the side effects are essentially zero. Garlic deserves specific mention. Garlic contains a compound called allicin, which has been shown to reduce oxidative stress in kidney tissue and provide a mild but measurable protective effect against glomerular damage. It is also a superb flavor replacement for salt, which alone makes it one of the most kidney-protective additions you can make to your cooking. Olive oil, particularly extra virgin, contains oleocanthal, a natural compound with anti-inflammatory properties similar in mechanism, though far milder, to ibuprofen but without any of the kidney toxicity. Replacing other cooking fats with olive oil is one of the lowest effort, highest return dietary shifts for kidney health. Cauliflower, cabbage, and other cruciferous vegetables are low in potassium and phosphorus, two minerals that damaged kidneys struggle to regulate, and rich in vitamin C and anti-inflammatory compounds. They provide excellent nutritional density without stressing filtration pathways. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, have been shown to reduce inflammation in kidney tissue and slow the progression of proteinuria in people with existing chronic kidney disease. Aim for 2 servings per week of fatty fish as a minimum. Finally, and I cannot say this strongly enough, control your blood pressure. Hypertension is the second leading cause of kidney failure worldwide. Every point you bring your systolic blood pressure down is measurable protection for the glomerular vessels inside your nephrons. Diet, movement, reduced sodium, stress management, all of it converges here. Even with everything I have just told you, I want to make sure you know what to look for. Because if kidney damage is already underway, catching it early, even if you cannot reverse it, can meaningfully slow its progression. The first warning sign is foam or bubbles in your urine that persist after flushing. This is called foamy urine, and while it can occasionally result from simply urinating forcefully, persistent foam is a strong indicator of protein in the urine, which means the filtration membrane is leaking, and that is always a reason to seek testing. The second warning sign is swelling in your ankles, feet, or around your eyes, particularly in the morning. This is called edema, and it happens when the kidneys fail to excrete enough sodium and water, causing fluid to accumulate in tissues. Mild ankle swelling has many causes, but swelling around the eyes is more specifically associated with kidney protein loss. The third warning sign is persistent fatigue that is not explained by poor sleep or other obvious causes. When kidneys fail to clear waste products efficiently, those products, including compounds called uremic toxins, accumulate in the bloodstream and cause a specific pervasive tiredness that rest does not resolve. The fourth is changes in urination, going significantly more or less frequently than usual, waking multiple times at night to urinate, or noticing your urine is darker or has an unusual odor without obvious dietary explanation. If you recognize any of these signs, even one, the appropriate next step is not to wait and see. It is to ask your doctor for a basic metabolic panel and a urine albumin to creatinine ratio. These are simple, inexpensive tests that tell your doctor the current state of your kidney function with considerable precision. Insist on them. You deserve to know. Here is what I want you to take away from everything I have shared with you today. Your kidneys are doing extraordinary work behind the scenes, every hour of every day, and they are doing it silently, which means you will not feel it when they start to struggle. The poisons I have described today are not exotic or rare. They are sitting in medicine cabinets and kitchen shelves in homes all over the world. After 60, the rules have changed. The margin for error is smaller. The same habits that were harmless at 40 can accelerate decline at 65. But here is the truth that the medical system rarely gives you enough time to hear. The changes that protect your kidneys are not complicated. They are not expensive. They are not painful. They are within your reach today. Drink more water, read sodium labels, reassess what pain relievers you are taking and how often, vet every supplement before it goes into your body, eat the foods I described, get your kidney numbers tested. That is it. That is the protocol. Not a supplement stack. Not an expensive program. Information applied consistently. One thing before I go. Write your age in the comments right now. I want to know who is watching this and where you are in your health journey, because that shapes everything I create for you going forward. Every comment tells me what to prioritize next. If this video gave you something valuable, please share it with someone you care about, a family member, a friend, someone over 60 who deserves to have this information, because the system is not going to hand deliver it to them at their next appointment. That is exactly why this channel exists. Subscribe to Dr. Nura Health. Hit the notification bell so you see every video the moment it is posted. And I will see you in the next one, because there is so much more I have to tell you.